So hello, everyone. I'm Laurent Colloud. I'm a software project manager at Debiotech. And today I'm going to talk about remote patient monitoring and see how technology can improve healthcare. First, let's take this example of this young boy. This young boy suffers from kidney failure, and his illness means going to the hospital 4 hours, 3 times a week. So we can easily imagine how being treated at home could help this young boy have a much better life. Today, we observe a global shift from hospital to home care because it improves patients' quality of life. Being treated at home means less time lost in transport to or from the hospital. It also provides more flexibility in the fact that it's easier to accommodate other important life activities like going to work or studying, for example. Being at home means being closer to the family and also being less exposed to possible contamination by going too often to the hospital, particularly so in the last year and a half of pandemic we've been through. And finally, overall, healthcare at home reduces the cost of treating the patient. Now, sending patient at home doesn't mean that he has to be deprived of the usual care he would get at the hospital. And those patients still need to be monitored in order to ensure that their therapy is successfully delivered. At Debiotech, we worked on a number of projects where we've implemented remote patient monitoring on diabetes treatment, for example, where we would monitor glucose levels at higher frequency in order to improve the therapy. And also on the dialysis projects, where we monitor key treatment data, but are also able to accept modified prescriptions edited at the clinic and pushed onto the device. So what do we call remote patient monitoring? RPM is a solution to collect health data which is securely transmitted through a number of systems to become available to the healthcare professional who will monitor the therapy. In this definition, we see the normal outflow of remote patient monitoring. But a real plus is if you can close the loop, meaning that the healthcare professional is able to edit a prescription at the clinic and push it to the device through the cloud so that the patient can have an improved therapy in a timely manner. And that's a real benefit for dialysis projects, and that's what we've done at Debiotech, because for a dialysis patient, he can get a much better timely response from the clinic compared to his normal monthly visit they would get by going to the hospital. Now, how do we implement RPM? First, we have to identify the data that needs to be monitored. And of course, this is going to be therapy dependent. Then we need to define the structure of the exchange data. And that can be either custom-made or standardized. Then you need to provide connectivity to your medical device. And here you have a broad range of solutions to do so. Fourth, you need to deploy a cloud infrastructure, which is going to provide the services to exchange the data and store the personal health data. And finally, you need to develop a monitoring software, which is going to be the tool used by the healthcare professionals to monitor the therapy remotely. Now, Implementing RPM doesn't come without a few challenges. Of course, we have to protect personal health data that we store. And if we're talking about encryption and authentication, that means that you need to deploy a public key infrastructure with all the certificates management that comes with it. And that's not an easy task. You need to make sure that your cloud solution is scalable. And this is going to depend on the number of devices that you have to deal with. And last but not least, you need to mitigate all cybersecurity risks of your solution. On the cloud side, of course, but more importantly on the device side. And because we're talking about a medical device, it's very important that you include your cybersecurity risk management very early on in your development process, because implementing the cybersecurity risk mitigations can significantly affect your device design. As a conclusion, we see that today there is a global shift from hospital to home care, and that remote patient monitoring is necessary in order to monitor those patients at home and adapt the therapies. And we've also seen that we have to take into consideration several challenges when implementing remote patient monitoring. That's it from me today. Please come and visit us. We'll be happy to talk with you about remote patient monitoring or any other subject you would like. And thanks for listening, and have a pleasant afternoon.